Melzer. I'm also at the Brain Research Institute, and I think a lot about taking pictures of the brain. So I think a lot about brain imaging. So I want to do something slightly different than what Michael did, in that I'd like to talk a little bit about some of the methods we use, some of the techniques we use to look at the brain at the New Zealand Brain Research Institute. So that's where we're going to start. Okay, so specifically I'd like to talk about brain imaging. And we use two main techniques to look at the brain in your skull while you're still alive. And we use two techniques, magnetic resonance imaging, or MRI, and that's an amazing imaging technique. It uses magnetic fields and radio waves to create detailed images of the brain. But we also use another imaging technique which is called positron emission tomography, or PET scanning, and you can see that just over on the right side of the screen. Now that does require the injection of radioactive material into the body, but it can produce some beautiful images of function of the brain. Now, one of the main benefits of both of these techniques is their flexibility. So by changing a few parameters, we can create a large number of different types of images. And these different types of images can tell us about specific aspects of brain health. So I'd like to show you what some of these images look like. So first up, we have brain structure. So we can use MRI to look at the structure of the brain. And here's an example. That allows us to look at the volume of particular tissues, the size of particular structures, the thickness of specific regions. And these are incredibly robust measures of brain status, of brain health. So what you're looking at here are three slices of the brain. So one is a slice looking sideways. The image in the middle is a slice looking front on from the brain, and the image over on the right is looking down on the brain from above. Now, the nice thing about brain imaging, or MRI, is we don't just have to look at single slices, right? So we can put these together, and we can essentially scroll through the entire brain, and that's what we have here. So this is starting at one edge of the brain and moving sequentially from one side to the other. So as we come in, we can enter in through the ear. You can see the brain there nicely. You can see some eyes there toward the front. You can see the spinal cord coming up. You can see some of the teeth, the nose. So what you can see is quite high resolution, quite good detail from these types of images. But we can extend that out a little bit further. We can actually create three-dimensional models of the brain, which look something like this. And so here, again, I just point out the nice detail. You can see that, well, this is actually my head. You can see my eyes were closed. You can see nice detail of the ears. You can actually see now some vessels coming up, feeding the brain with blood. And I've made a cut down the side of my head, and so you can look in and see that gorgeous brain in all its glory. But again, we're not limited to just structure with this type of imaging. We can look at function, or we can look at blood flow. And so one of our newer sequences allows us to look at how the blood enters the brain. So that's what I have here. So we're looking at the main vessels which carry the blood into the brain. And what we can do is take a look at actually how, and you can see in color here, how the blood moves through those vessels into the brain. And this is all done non-invasively. This is all safe and very straightforward to do. Well, actually, it's not that straightforward to do. But once you figure it out, it works pretty well. Right, so we can actually continue. So we can look at what happens when the blood enters the brain, and then as it continues up on its journey to enter into the tissue and then bring the tissue the oxygen and the nutrients that it needs. So we can look at how the blood flow arrives in the brain tissue itself, and that's what we have an example of here. So this is a series of images which start at the bottom of the brain and are just moving up to the top of the brain, starting at the bottom of the brain there on the left and to the top of the brain on the right. And the red color that you see there is indicating where we see high levels of blood flow in the brain. Now we can take this one step further, and we can start as the blood reaches the brain, as the blood hits the tissue, and we can also look at any potential consequences of dysfunction in that vascular tree. And so sometimes you can have mini strokes, you can have blockages, you can have some sort of issue with the blood flow, which then will lead to some damage to the tissue. And we can pick up that damage to the tissue in this particular scan. So if you look over here, hopefully you can see on the left some slightly lighter or whiter areas, which we interpret to be lesions in the brain as a consequence probably of vascular origin. And over on the right there in red, we have automated methods to actually identify where those lesions are occurring. And we can use that type of information to look at aging or to look at disease progression and see how these lesions within the brain relate to disease progression. Right, so we can also look at how the brain is actually structurally connected. How is a region over here in the brain connected to another region across the entire brain? And we can use an exciting technique called diffusion MR, and it allows us to create these pretty pictures, but it also allows us to trace out individual fiber pathways. So how do we go from point A to point B? So this image, I quite like. This is an image as if you're looking straight on to the brain. And color here indicates the direction that these different fibers travel. So if you look down to the bottom of the image, it's kind of bluish purple. But if you follow that up, that actually is a fiber which is traveling up from the spinal cord all the way up to the top of the brain. And this gives us very sensitive measures of how is the connective tissue doing. Is it healthy? Is it starting to show some dysfunction or some damage? Right, again, we don't just have to look at structure, we can also look at function. And you've probably heard of functional MRI or fMRI, and this actually allows us to look at how the brain is functioning in vivo, right? So we can put someone into the scanner and we can actually scan them with functional MRI. And what you see on the left is a result of that. So we've asked a person to go into the scanner, they've gone in for 8 minutes, we've asked them to close their eyes, to not think about anything in particular, and what you see in yellow are different areas of the brain which are active, they're increasing their activity. So what we can see is that the brain is never actually at rest. It's always busy, it's always being active, and so that's what you can see in the yellow. On the right, that's an example that's looking at the back of the head, and you can see the yellow and orange, or the yellow and red there, is indicating where we see increased function when looking at a flashing checkerboard. So we see a flashing checkerboard, and the area of our brain which is responsible for visual processing, for processing what we're seeing, shows an increase in activity, and we can actually pick that up with the scanner and indicate it there in red. Right, quickly, changing from MRI, we also use, as I mentioned, PET imaging. And again, its flexibility is incredible, and that allows us to look at something called, allows us to look at proteins and how they are accumulated in the brain. So we have a particular protein called beta amyloid or amyloid. This is a protein which it misfolds, it sticks together, it clumps together, and it kind of gets deposited in the brain tissue. And this is a pathological hallmark of Alzheimer's disease. So we see this occurring in Alzheimer's disease. Previously, we couldn't actually image this. We don't know if there's amyloid in the brain or not until recently. And now we can use amyloid PET, and we can actually take a picture of the brain and see whether there is this pathological protein or not. And that's what you can see over here on the right. The image there in the middle, that's what a healthy brain looks like. You don't see much amyloid deposition or accumulation there. And on the far right, hopefully you see a striking difference. There's lots and lots of red there, indicating high levels of amyloid accumulation. And that's what you would tend to see in diseases like Alzheimer's disease. So there was a whirlwind introduction to the amazing imaging techniques which we use. They really do produce some beautiful images which are very useful. And at the NZBRI, we're using these in a number of different studies and a number of different diseases. So I primarily am also involved in Parkinson's, and so I use these different imaging techniques to try and tell me more about what's happening in the brain and how the disease is progressing. But we also use these techniques to look at things like Alzheimer's disease. Also, if you go to the other end of the age spectrum, we use these images to look at child development, preterm birth, very low birth weight. But we also look at things like neuropsychiatric issues like depression or apathy or post-traumatic stress disorder, and a number of different things. So I think, actually, I'll leave it there. But I just want to leave you with the idea that these imaging techniques are great. They give us a unique insight into what's actually happening in the brain. We can look at structure, we can look at function, and we can use that information to tell us a bit more about disease, about aging, about development. And we do that at the NZBRI. So, thanks a lot for your time.